Indicators are components of the evaluation planning process. They are qualitative or quantitative data that needs to be collected to see if the outputs affect the outcomes of the project. Based on the input, output, and outcomes, and the focus of my logic model, here is my evaluation plan. The focus of this project is to see the effectiveness of using an automated best practice alert in the electronic health record in the provision of a self-management educational program and care management support after discharge from inpatient and to outpatient on patients' health behaviors. So, what do I want to know? First would be what is the effect of the use of the best practice alert on the self-management educational program enrollment, and the indicator uh, that to choose to see if this process will work would be the enrollment rate of the patients, and we will measure this 1 month after the implementation of the best practice alert, uh, and we will run a monthly data for monitoring. Second question would be, what is the effect of a focused support follow-up aimed at completion of the self-management educational program? Uh, we will measure this process by if it's what the effect of it is through the completion rate of the educational program, and we will also measure this 1 month after the implementation of the best practice alert. We will run a monthly data for monitoring. The third question that I would want to know is the effect of the self-management education program on knowledge with the patient knowledge with self-management. We can do this by comparing the pre and post test data. We will also collect this 1 month after the implementation of the best practice alert and ongoing per patient. Fourth question is, what is the effect of the self-education, a self-management education program on patients' health behavior? Um, we will measure this by looking at the medication adherence with albuterol inhaler and oral corticosteroids. And I would also want, and the last question would be, what is the effect of the outpatient follow-up care? Uh, we will, um, and of course, the self-management educational program. Uh, we will measure this by looking at the COPD readmission rate. We will also the medication adherence and the COPD readmission rate will be um, evaluated or looked at 3 months after the implementation of the project and will be run monthly thereafter. Um, so data collection. So where will we get the data? The sources would be from the departments involved, which is the population care, transitional care, data analytics team, and pharmacy department for the medication adherence. The methods for collection is information will be gathered from the electronic health record. Clarity reports will be created and emailed automatically to the stakeholders, and we will do this with the assistance of the data analytics team or your health information team. Who will be questioned, or who are the sample in of the data? These are patients 40 years or over, discharged from the emergency room, inpatient and urgent care with a diagnosis of COPD, chronic bronchitis, and or emphysema. What are the instruments or the tools that we will use to collect data? First is the clarity reports from the electronic health records and reports of pharmacy data, which is the refills or purchase data. So number 6 question for the evaluation plan is, how will the data be analyzed? The SMAP enrollment rate will be interpreted as the SMAP enrollment rate determines the effectiveness of the best practice alert as a tool, as well as it determines the effectiveness of the training program for the emergency room, urgent care, and inpatient nurses, because we will train them using the best practice alert. The SMAP completion rate determines the effectiveness of the follow-up care provided by the population care, primary care, or transitional care departments. Medication adherence rate measures the change in behavior of patients receiving and completing the self-management educational program. And the COPD readmission rate measures the effectiveness of the educational program itself and the outpatient follow-up care. And so who will get the data for this project? The data will be provided to all the stakeholders, which are located in the inputs of the logic model. We'll receive a clarity report daily. The clarity report will also be available on a SharePoint site where anyone who wants to know the data can have access to it. When and where or how the data will be communicated, as mentioned before, the data will be available on a SharePoint site, which can be accessed anytime. Data can also be presented in the monthly quality meeting presented by the population care departments to all the stakeholders.